So I woke up from that surgery and I just remember screaming, like, I didn't know if I had my ovaries. I can't do this anymore. This is my last time that I'm coming here. These are my symptoms. I need help. And he said, I'm not 100% sure, but you've either got one womb, two wombs, or no womb. And I was just like, what? They just didn't believe that this, what I now know is chronic inflammation that was happening in my stomach, could be anything other than chlamydia. Anything that goes on, especially when it's related to women's health or the cycle, is always dismissed, always misdiagnosed, and you're just made to feel like another woman complaining about a problem and there's nothing wrong with you. I had period pain for 10 years. I had 4 surgeries for endometriosis and nothing took my pain away like the AIP diet. I'd had the wrong surgery for endometriosis and it happens all the time. To this day, there will be someone having an endometriosis surgery as I'm speaking and it's the wrong surgery. I sit here with no pain, no endometriosis symptoms. My periods are normal because of what I learnt. Everyone with endometriosis needs to know this. Hello and welcome back to Finally Found, the podcast that is finally giving women's health the attention that it deserves and you the answers that you've been looking for. Today's episode is going to be a little bit different because it's actually a solo episode with me. I was really passionate about this podcast having expert guests on to share their incredible information to give us actionable steps. But today I actually wanted to be the person in the chair because I wanted to share my in-depth journey with endometriosis, and this does come with a trigger warning. I get very emotional because my journey has been quite turbulent and I know that a lot of other people's has as well. And I also share my journey with fertility, or rather infertility, and I know that for a lot of people that can be a lot. So I just want you to be aware of that before you go on to this episode. What I'm also going to talk to you about, and is probably one of the main reasons you guys have found me, is the AIP, or the autoimmune protocol, because that diet changed my life. So I'm going to tell you exactly what the diet is, how it works and who it's for, because even though it changed my life, it's not for everyone and it's very extreme. And also what's happened since the AIP, because it's been a whole year, so I feel like we have a lot to catch up on. So without further ado, let's get into the episode. I think the best place to start is with the start of my journey with endometriosis and how and what I'm doing at the moment, because my life wasn't always focused on health. I had like a very normal life from age like 0 to 17. I had like various health issues, always struggled with constipation, but everything was like pretty normal in terms of what I was going through. And then I got my period at 17, which I know sounds really, really late, but everyone starts their period at different points. And that wasn't an indication that I had endometriosis. At this point, I was just like everyone else, but running a bit behind. And I remember saying like, I was so jealous of my friends that had like pads and tampons, and I always wanted to get involved with that. Like they'd go to the toilets and I was like, when is my time going to come? And then I turned 17, got my period, and very quickly within the first couple of months was just like, what the fuck is going on? Because I wasn't having the experience that they were having. So for example, for them on their period, they would be like, oh God, my period's come. Where are the pads? Where are the tampons? For me, it was like the week before my period came, all hell would break loose. Like my stomach was like churning. And then on my period, I was exhausted, like not just tired. I'm talking like the alarm would go off and I'd be like, I feel like I haven't had a wink of sleep. But it would be like that the entire time I was on my period. And they were just getting heavier and heavier and heavier. And I found it really embarrassing because, again, all my friends had had their periods for ages. They were getting on with life with a breeze. And I just kind of felt like I was being the dramatic one. And in the end, I was bleeding through all my pads. I was bleeding through tampons. I was doubling up, wearing a tampon and a pad, which should have been such a red flag that something was wrong. And then went to the doctor, and I feel like this is the episode that I'm going to cry in because we haven't had any tears yet. And I feel like this is going to be the one. But I went to the doctor and I literally just said, I was like, look, I don't know if there's something wrong with me, but I can't hack my periods. Like I can't cope with them. And sort of gave the context that I'd only just started them. And he was just like, oh, don't worry about it. This is just period pain. Everyone has it. And you just need to get used to it because your friends have had periods for like 3-4 years. You've only just got yours. Like, don't worry about it. It'll settle. And I kind of understood. I was like, okay, fine. Like maybe I'm just not used to this, or maybe my hormones would balance like they always say. And it just didn't. It got worse and worse every single month. And I actually was quite persistent at going back to the doctors because I did kind of feel like I was dying every month, which sounds dramatic. And then I went to the doctors and they were just like, you're being dramatic. One of them genuinely said that it was basically in my head and said that I had like phantom symptoms. It's called psychosomatic symptoms. And I was just like, okay, well, maybe I'm thinking these thoughts in my head, but you can't explain the fact that I'm flooding through my pads and tampons and bleeding through my clothes. Like that's visibly there. And the answer was always try a new pill, try a different pill, try 2 pills. And they were making the situation so much worse. And knowing what I do now about endometriosis, it was so obvious. And so I want to share a bit more about my journey with you so that hopefully if anyone is out there in the process of being diagnosed with endo or you're absolutely in the pits with it, hopefully this will help you. So I went through this stage of like all these different pills, being told I was being dramatic, being told I was literally making it up in my head that I didn't have period pain and it was just normal, etc. And ended up having emergency surgery. So I was really ill. I was in the middle of my A-levels. And by this point, it was 2 years that I'd been struggling with this pain. I was in the middle of my A-levels and I was flooding through all my pads and tampons, getting very faint, very lightheaded. But by this point, it was my new normal. And I just thought, I'm just going to sleep through it like I always do. I've got my exam tomorrow. And like, you know, when you're in the middle of your A-levels, like that's the most important thing to you, right? So go to my A-levels and then into my exam. And I don't actually really remember anything from that other than collapsing, waking up in hospital and finding out that I'd had keyhole surgery on my stomach. Because during this time I had a cyst on my ovary, which they said wasn't problematic at all. But during the surgery, they realised that this cyst had grown to a size of an orange, had twisted my fallopian tube, and they'd removed it. And they said that the reason I was in so much pain all the time was this cyst, which I had been told was not problematic. So they removed it and really casually said, your organs were a bit glued together, but that's, again, very normal and you're absolutely fine. So I kind of thought like my prayers have been answered. Like I'm in pain from the surgery, but maybe this means that my periods are going to be normal. It was just the cyst. And that just wasn't the case. 3 weeks later, pain came flying back. And by this point, I was going into my university kind of era of life. And 2 things happened. One, going into university, alcohol consumption went through the roof for like the first 3-4 months for me. I was drinking loads. I was eating crap. Breakfast, lunch and dinner was like lasagna and chips all day, every day. And I loved that kind of food back then. I had no concept of nutrition or health or anything and thought like a veggie lasagna was being healthy. So everything was getting worse. Went to a new doctor thinking this is going to be, you know, helpful. It's a new doctor. And the doctor, instead of saying it was in my head and that it was just period pain, the conversation shifted to being like, oh, you're a young fresher. You probably just have an STI. How many sexual partners have you had this month? And it was such a horrifying question because, again, at this point in my life, which I think is insane. If you follow me on socials, you will know how open I am now about talking about sex, periods, poo, blood, everything. Back then, I could barely say the word period without feeling embarrassed. So to have someone be like, how many sexual partners have you had this month? Just like really casually, really dismissive, quite judgmental. And the sad reality was I was in so much pain that I was not having sex with anyone. Like I'd stopped going out. I had a boyfriend. I had one partner the entire time I was at university. And even when I said that, she just didn't care. And I say she because it was a female doctor. Everyone always blames male doctors. But my experience with female doctors is sometimes because they have periods themselves, they almost go, well, I get on with it. Why can't you? And she was really dismissive, questioned me again about how many sexual partners I had as if I was lying. And throughout the next 2 years of my life at university, I had over 17 STI tests that were all negative. I only had one partner. We were both faithful. And they just didn't believe that this, what I now know is chronic inflammation that was happening in my stomach, could be anything other than chlamydia. That was like the only answer that they could have. And I really appreciate that in a university environment, people have a lot more fun and maybe it's not protected and maybe chlamydia is much higher when you go to university, fine. But that was not my story. And they were so hell-bent on diagnosing me with an STI that they didn't care what the results were until I finally broke down and I was like, I'm either going to leave university or like just drop out of life because I was like, I can't do this anymore. And I went to a GP and I just said, this is my last time that I'm coming here. These are my symptoms. I need help. And it was a new GP. He like jumped out of his chair, got really excited, which was really bizarre because I just told him I was like in agony, probably very depressed and just like couldn't deal with life. And he was like, oh, I think you have this thing, and pulled this file out of his folder and said, I've just been to a women's health conference. I think you've got endometriosis. Your symptoms are exactly the same. And I said, what the fuck is endometriosis? I could barely say it rather. And he said, I'm not 100% sure, but you've either got one womb, 2 wombs or no womb, but we'll figure it out. And I was just like, what? I was like, what do you mean I don't have a womb or I have 2 wombs? Like, what the hell does this mean? And I always knew that I wanted to be a mum. Right, I'm going to take a deep breath because I I think it's fine to get emotional. I just didn't expect to get this emotional, but I never talk about that part of my life ever. I know that I've kind of locked that part of my life into a box and never want to open it again. And because my life now is so amazing, and I'm so glad that it is, and there's specific tools that I've done to make my life amazing. Like, I don't experience pain anymore. And the things that I'm going to tell you in this podcast, so I want you to listen to it. But I also think it's important to recognise what I have been through, what has happened, because I am not a unlucky person to have gone through that. I am the normal person with endometriosis, or insert any other women's health condition, PCOS, fibromyalgia, infertility, anything that goes on, especially when it's related to women's health or the cycle, is always dismissed, always misdiagnosed. And you are just made to feel like absolute shit. And you're just made to feel like another woman complaining about a problem and there's nothing wrong with you. And going through all of this, like I've already mentioned, I had surgery and they said I'd be fine and I wasn't. After this doctor had mentioned this term endometriosis, which now, thankfully, so many people have heard of. We'll call it Endo for the rest of the episode because it's a bit of a mouthful. But I went under what they call a diagnostic laparoscopy. So that means basically keyhole surgery, so small incisions on your stomach where they go in, and a diagnostic laparoscopy is basically they go in to see if there's anything going on, and if there is, they can diagnose you. So they don't necessarily do anything in the operation, they just have a look. So I went through my second surgery and they went in looking for endometriosis. They found it and they said it was in a tiny place called the pouch of Douglas, which is basically very near your womb and your rectum. Again, remember this, please, for a second. So I came out of the surgery. They said I had endometriosis. They said they'd lasered it off and that off I went, my problems would be solved. But they did say it was chronic, which means you can't get rid of it. I have this condition for life. But they said that they'd got rid of it. So surely that means like I'm fine, right? So the months went on and I really felt quite a lot of relief after having that surgery. I felt much better. And then 4 months later, almost to the day, I woke up bolt right in uni, screaming agony. Like I was fast asleep and was woken up by this pain. And it was the exact same pain I'd experienced before the surgery, that corkscrew twisting pain in my stomach that literally felt like someone was trying to get a bottle out of me. Like the corkscrew feeling was so strong on both sides. And also this deep rectum pain, and something which I really failed to communicate because I almost didn't know it was a symptom. I found it really hard, like the language of symptoms, I found it hard to almost speak that language to the doctors. But what I had been experiencing was rectal pain, so literally pain in my bum. So during my period, I used to bleed and I'd bleed from my bum. And I was like, what's going on? I'm having this like tugging sensation in my stomach, but also my bum. Talked to the doctor about it. And again, they basically said, look, you have endometriosis. It's chronic. You can have some wacky symptoms from it, including rectum pain. And the only thing you can do to cure endometriosis is either have a baby, because having a baby cures endometriosis, or have a hysterectomy, because that's also meant to cure endometriosis. For context, I'm 21 at this stage. So from the ages of 17 to 21, every month for me was agony. And it wasn't just the week on my period, which was actually then 10 days because my periods got heavier and longer, but it was actually the run up to my period as well. So basically 2 weeks out of the month, like I'm out of it, zombie, trying to get through university, trying to get along with my partner, who was such a lovely guy. But relationships can be such a struggle with chronic health because you just feel like a burden all the time because you're always the ill one that they have to care for. And the thought of then having to have a baby at 21, like I wasn't ready, my partner wasn't ready. And I remember him saying, like, if we need to have that conversation, like, let's have it. He was an angel. But I was a baby myself, like I was not ready to have a baby. And so a hysterectomy at the age of 21, total removal of my womb and a sure guaranteed that I was not going to be a mum, at least produce my own baby and have my own baby, felt like a really good idea. Like that's how much pain I was in. And thankfully, the waiting list at the NHS is so long. So I just said, look, I've gritted through this pain for long enough. I can carry on till this surgery, which was meant to be in like 2 to 3 years was the waiting list. So I carried on, went on my placement year to London. And this was the turning point for me. And this is when my life changed. So I went to London, context, I'm Welsh, just from Wales. All my treatment had been in Wales. Went to London and went to the GP to get Oromorph, which was like a tablet morphine because it was the only way I could get through my periods, but I had to get it prescribed every month. And this doctor just turned to me and looked me dead in the eye and was like, gosh, you've been through a lot. Like you're really young to be on Oromorph every month. And I broke down because I was like, it was the first time in 5 years that a doctor had actually looked at me as if I was a human, not just looking to prescribe me another contraceptive pill, and said, do you mind if we look into this further? And I was just like, don't worry about it. I've had the endo surgery. Like, there's nothing they can do. I'm just going to get a hysterectomy. Like, you're fine. And she was like, I don't think this is right. And this is when I realised that some doctors can be wrong. So she referred me to an endometriosis specialist. She's called Professor Janice Reimer, and she works in London, and she's amazing. So I went to the endometriosis specialist, and she told me 3 things that changed my life. And everyone with endometriosis needs to know this. First of all, a hysterectomy does not cure endometriosis. It can help a similar condition called adenomyosis, something I don't have. I have endo. So I could have had my womb out for no reason. And this happens all the time. I'm not a freak accident. It happens all the time. Number 2, a baby does not cure endometriosis. There's this misconception because a lot of women, and this is true, that after pregnancy, your hormones can shift. So sometimes people feel better. Sometimes people feel worse. Like, I remember I chatted to Molly May. What a name drop. I basically accosted her at an event. I ran after her in M&S. It's very embarrassing. And I was just like, Molly, I love you. And I was talking to her about her endometriosis journey. And I said, like, how are you doing? And she was like, to be honest with you, I feel really guilty even talking about it because I don't have any symptoms anymore. And she's obviously had Bambi. And she said after having Bambi, she felt amazing. And I was like, oh my God, like maybe this will happen to me one day, fucking fingers and toes crossed. But it's not guaranteed. And for some people, it goes the other way. So this doctor that told me to have a baby could have just made my life way worse. And also fertility struggles with endometriosis. Not everyone can just have a baby. And then the third thing, which I was just like, this is insane. I'd had the wrong surgery for endometriosis, and it happens all the time. To this day, there will be someone having an endometriosis surgery as I'm speaking, and it's the wrong surgery. So Cliff Notes version, there's 2. One is called ablation, one is called excision. Ablation surgery is where you laser the endometriosis off, what I had, and that grows back really quickly. Excision surgery is when you rip it out at the root. Unfortunately, cells will always be left behind in both surgeries, and so endo will grow back in both. But excision surgery, way longer lasting. So long story short, ended up having to have a couple more surgeries. Excision surgery, the right one, and felt so much better. But I knew I wanted to go on this kind of journey of freezing my eggs because every surgery I've had 4 in total. Every surgery I had, they hacked away at my ovaries. And even with my health context of knowing I have endometriosis, knowing I've had these 4 surgeries, the conversation I always had when I tried to talk about my fertility, because I was 24 having this conversation, was, oh gosh, you're young, don't worry about it, you're absolutely fine. But in my last surgery, I had to sign a waiver. It was an emergency surgery because, long story short, I think this could be an entire episode. I basically ignored extreme agony because I thought it was just another flare. And it turns out a flare-up rolled into appendicitis, which rolled up into me almost dying. So I had to have emergency surgery. And they basically said I had to sign this waiver saying that they were allowed to take my ovaries out. I was 24. I had to make this decision on my own. And it was horrendous. I had no one around me. So I woke up from that surgery and I just remember screaming, like, I didn't know if I had my ovaries. And I just thought, I felt so stupid for listening to the doctors because they were like, you're too young to be freezing your eggs. And I was like, this is exactly why I wanted to freeze them. Thankfully, I woke up and I still had my ovaries. They took my appendix out. They took more of my ovary out, and some of my endometriosis had grown back. So they also took that out. And thankfully, that is my last surgery. But the reason that is my last surgery is because I just said, enough is enough. I was like, I can't do this anymore of going through this up and down with my health journey. And I was like, something has to change. So I basically did something quite drastic. I knew that I needed to freeze my eggs, but I couldn't afford it. So I quit my job and took a job in London purely because I knew the signing bonus was massive. And I was like, what are the terms and conditions? They were like, you have to work there for a year. So I was like, brilliant. I'll take the job. I'll work there literally 365 days and then I'm quitting. Did that. Went through 2 rounds of egg freezing, which went really, really well. So I was able to afford 1 round and my parents thankfully paid for the other, which I'm so grateful for. And after that, I said, I'm going to quit my job. I'm going to train to become a women's health practitioner because I want to understand everything about hormones, because I started realizing that all of my issues and my symptoms were related to my cycle. And I was struggling with something that I always used to call bloating and I now know is inflammation. And I was like, if I train, I can actually teach it to myself, learn it on myself, use myself as a guinea pig. And if somehow by magic this all works, I can hopefully teach other people. So that's why I started my page, which used to be called The Endo Spectrum and is now just called my name, Sophie Richards, on Instagram and TikTok and YouTube. And basically through this women's health course was learning about hormones, learning about something called the hormonal hierarchy and how important cortisol and insulin are and how they dominate this hierarchy. And so if any of those two hormones are off, they can throw all of your other hormones off, including estrogen, progesterone, testosterone, all of these hormones that are involved in the cycle. And in this course, they were talking about how, yes, endometriosis and PCOS and all of these other conditions are different, but what brings them together is that everyone says that these symptoms are these conditions are driving these symptoms, but if you can get to the root of what's driving that condition, you can fill that, you can plug the gap, you can stop it. And it's not the case for everyone. Not everyone gets the privilege of having this instant switch where their symptoms get taken away. But this term inflammation kept coming up, and it was basically talking about how inflammation can fuel these conditions, which then fuels these symptoms. And I was just like, okay, well, what is inflammation? It's supposed to be a good thing because it's supposed to be your body's natural defense mechanism. But if your body is constantly fighting itself because you've got autoimmune conditions or conditions that are similar, like endometriosis, like PCOS, like arthritis, there are so many conditions that inflammation drives them and then makes the symptoms worse. So if you can get rid of this inflammation, this chronic inflammation that's going on in your body, you can hopefully live a pain-free life. And I just kind of thought, I call bullshit. I was like, I don't think any of this works. I was like, I've seen the TikToks, I don't believe it. And actually, it worked. I sit here with no pain, no endometriosis symptoms. My periods are normal because of what I learnt, and it all comes down to inflammation. So in this women's health course, we were learning about the power of food and ultra-processed foods, and it just completely blew my mind because I thought I was being healthy. I ate the protein bars. I sort of did my walks every now and again. I ate relatively healthy in my eyes, but healthy was very, very different to what I actually was eating because I didn't realize how ultra-processed my diet was. And 3 anti-inflammatory diets came up in the course. One was the AIP diet, one was the histamine diet, and one was the low FODMAP diet. Most people have heard of the low FODMAP diet, and I'd actually tried this years ago because it was the first thing I was told to do for my endometriosis. And yes, I learned that garlic, leeks, and too much broccoli can make me a bit gassy, but it had no correlation to my endometriosis symptoms whatsoever. The histamine diet, I learned about it. I learned about the symptoms of if you struggle with histamines. And although I actually do think I struggle with it, we'll come onto my skin in a second, I didn't really resonate with it. And anyway, went on this endometriosis retreat by a company called Hold Wellbeing. It's amazing. And there was this awesome practitioner in there called Kirsty. And she was, again, talking about these 3 diets, talked about the autoimmune protocol. And I just locked in. I was like, I think this is the anti-inflammatory diet that's going to change my life. And it did. It's very extreme. It's for people with autoimmune conditions or conditions that are similar. And for that reason, that's the community of people that should be looking at something like the autoimmune protocol. And it's basically a 3-phase diet. Phase 1 is elimination. You basically eliminate a whole bunch of things from your diet so that you basically, the goal is that you get rid of all of your symptoms. And once your symptoms are gone, you enter phase 2, which is reintroduction. So when it comes to the elimination phase, it's easier for me to tell you what you can eat than what you can't. It's meat, fish, fruit, veg. That's basically it. And even within fruit and veg, there's a category of food called nightshades. So things like red tomatoes, white potatoes, aubergines that you also can't have on this protocol. And it's the reason behind it is that these ingredients can be inflammatory for people. So when you are on the elimination phase of the autoimmune protocol, you can't even have nut seeds. You can't have coffee because coffee is a seed. So you are literally eating the most unprocessed diet known to man, but you're also cutting out grains, legumes, rice, for example. You do it until your symptoms go away. And if your symptoms go away, then it's a big sign that actually it could be something to do with what you're eating that's causing those triggers. So for me, I did it for my endometriosis, my inflammation, and my acne. I did it for 30 days, the elimination period. All of my symptoms went away other than one. So my period pain disappeared. Bearing in mind, at this point, I'd been suffering for 10 years. I did this diet last year. I was 27. I had period pain for 10 years. I had 4 surgeries for endometriosis and nothing took my pain away like the AIP diet. It was insane. No period pain. My period was lighter. I had no idea that my period was even coming when it did. And that has been the case 1 year on. Nothing has happened since. It's all been amazing. my inflammation, my bloating went, and then my weight, which had been like creeping up and up. And I know that weight is a sensitive topic, but I think there are so many people who are, and I put in quotations, struggling with their weight when actually it's inflammation. So in the space of 30 days, I lost almost a stone in weight. And it was all inflammation because I was eating calories like there was no tomorrow. I didn't get rid of my acne symptoms. That was the only thing that stayed. And my lesson from the AIP is that I think my skin isn't driven by food, it's driven by other pillars, which we'll come on to. And I think it's a really important topic to talk about. So when you go through phase 1, the elimination phase, towards the end of that, when your symptoms have gone, you reintroduce all of these ingredients one at a time every 3 days. It's the most painful thing ever. So I hope that you are realizing how extreme and how long this diet is and how committed you have to be to it if you do want to do it and if you're safe to do it. It's extreme. And it basically takes over your life for like at least 4 months. And I went all in, did the reintroduction, and then you go into maintenance. So from the reintroduction, when you reintroduce these foods, you see if any of them are triggers for you. And the only major triggers that I had were 2 things. One was an instant trigger. If you found me through socials, you'll have seen that I was like famous for having this massive belly. It literally went from like super flat stomach to having like looking like I was 9 months pregnant because I'd eaten chili flakes. All this time, I thought that it was sourdough bread and all this other stuff that was making my stomach bad, but it was actually chili flakes because every weekend I would have eggs on sourdough toast and they used to sprinkle chili flakes on the avocado, and I just thought it was the bread that was making me ill, but it was actually the chili flakes. So I've completely removed chili from my life. I have tiny amounts of it. If there's like traces of it, I'm fine, but anything more than that and it causes a huge trigger. So chili was my main one. Ultra processed foods were my second. So I still have them every now and again. I'll still have a bit of croissant. I'll still have a bit of bread every now and again, but it is very limited. And I would genuinely say that everyone talks about this 80-20 of like eating healthy 80% of the time and 20 not, and 20, eating whatever. For me, it's like 95-5 or 90-10, because as soon as ultra processed foods come back into my diet, my flares come back. So since doing the AIP over a year ago, I've only ever had 2 flare-ups. One was when I was traveling and I got barley belly and had the worst gut ever and I was eating lots of processed foods out there. And the other time was when I had to go on antibiotics. That's the only time I've ever had pain. So as long as I stick to the lessons that I've learned, it's fine. When it comes to the reintroduction phase, this is the phase that people feel the most confused about when it comes to AIP. And I totally get it, because if you research the AIP online, there are like 20 different versions of the diet. And that's why I made my own guide of exactly what I did step by step and how to do it. But the reintroduction phase is very, very specific. So there's a hierarchy of foods that you start with first of all. Now you can choose to do it in any way that you want to. I knew that there was a hierarchy, but for me, I wanted to start with the foods that I use and eat all the time, because I found it really difficult avoiding everything all the time. And I was like, coffee, I love coffee. I just want to reintroduce that first. So you can do it in either way. You can follow the structured one, which is in the guide, or you can go, do you know what? These are the main ingredients that I love and I'm going to reintroduce those first. It's up to you. So for me, I started off with coffee, and you basically reintroduce, they say, a teaspoon amount, see how you go. And then over the course of those 3 days, see how you still feel with that. So for example, with coffee, I had 2 to 3 sips of coffee and then didn't do anything else for the next 3 days. I just carried on with what I was doing and saw if I had a reaction. And by reaction, I mean any form of inflammation that you have struggled with your symptoms. So for me, it was very classic. It was this swollen stomach. That's what I was looking for, because that's my kind of reaction symptom. Nothing. Rice, the same. When I reintroduced rice, I had 2 to 3 teaspoons of rice, ate it, waited 3 days, see what happened, and then reintroduced it. Because you've gone without these foods for quite a long time, it's good to make sure that you're then slowly increasing the amounts that you're eating, rather than going, rice is great, let's have a big butter bowl for lunch, because obviously that's going to be quite a lot of food that you're not used to, but there's a process to follow with it. But again, there's a specific step-by-step in the guide, and we'll pop the AIP guide in the show notes. There's also a recipe guide as well, because the elimination phase can feel really difficult when you don't know what meals to make. So there's also a recipe guide there. So I'll put everything in the show notes. Just pausing the episode to say a big thank you to the sponsor of this podcast, Boira. If you've followed me for a while, you know I'm all about natural pain relief, and their TENS machines are genuinely amazing. My go-to is specifically the Boira EM50 TENS machine with heat technology. If I'm having an endo flare-up or cramping from my period, I just pop it on, and the combo of the TENS technology plus heat therapy is pure bliss. I wear it at home, on the go, and it's an absolute dream for flights, and I recommend it to everyone I know who wants non-medication support for pain. And if you want to get your own, you'll find the link to the Boira EM50 in the show notes, and make sure to use the code FOUND at checkout. It's your exclusive listener discount. And now let's get back to the episode. So after reintroducing all of these ingredients and seeing what flares you and what doesn't, you're then supposed to go into this, what they call the maintenance phase, which is forever, which is basically all of the lessons that you've learned. So for me, those two would be very careful of chili. I've noticed that small amounts, trace amounts, I'm fine with. But as soon as I feel something hot in my mouth, I know that my stomach's not going to deal with it. And just for me, chili is a big trigger. And ultra processed foods, which is why for me, my diet is very 90 to 95% unprocessed and 5 to 10% processed, because I still think I need to live a life, and also living on the go in the world that we're in, almost everything is processed. So it's really hard to do it on the go. But as long as I stick to that percentage, I am A-okay. But the problem with the AIP is that it only focuses on food. And doing the women's health practitioner course that I'm on, and doing extra research outside of that on inflammation, because remember, all of my symptoms went away other than my skin, and acne is an inflammatory skin condition. And I thought, well, I've gone on this extreme anti-inflammatory diet. Why hasn't my skin changed? And it's interesting because I have this community on socials where everyone shares their AIP journey. And the two biggest things, or three biggest things that people say are, oh my God, I've lost so much weight on it, because they're holding on to water weight. 2, their swollen belly completely disappears. And 3, their skin transforms. And there's before and after photos that you can go in and see. And it's insane. And I just thought, fuck's sake, why hasn't this happened to me? But again, if my skin symptoms didn't go away on the AIP diet, the lesson is that food is not my acne trigger. And realizing that food, of course, can cause inflammation, but there are so many other things that can cause inflammation that the AIP does not cover. The pillars of inflammation, I call them, are food, gut health, detoxification, sleep, stress, and movement. The AIP only focuses on a small part, which is the food. So I knew that I had this other kind of journey of inflammation to go on and study. And I found it fascinating because I realized that actually for some people, they might deal with extreme inflammation, do the AIP and not find any relief from it. And that's because the source of their inflammation isn't food. It's because they have a really stressful, chaotic life at home, or their job is horrendous and it's making them really stressed, or they're not moving their body enough, which is causing inflammation. There's all of these pillars that we need to look at. And it was only when I really started digging into that I realized, whoa, there is a big problem here where loads of people are doing the AIP and they don't need to. It's an extreme protocol that you should be going to your doctor to see whether or not it's for you or not. And it can be life-changing. It changed my life. And I know for a fact that I would not be sat here doing everything that I'm doing right now had I not have done the AIP. However, the problem is it's very extreme. It's very restrictive. It's only focused on food, which one, if your inflammation is not driven by food, it might not help you. But also because of that food issue, if you do have a history of things like eating disorders, the AIP is something you should never do, at least not do on your own. Go and speak to your therapist, your doctor, and see if it's something for you and if you can do it with them in a safe way. I personally wouldn't do it if I had issues with food because it forces you to be so focused on food. It's very positive for me because I understood how to read labels correctly and it opened my eyes to like the world of healthy food that's delicious. But I know for a lot of people, it can actually be quite damaging when it comes to mental health around food. So for everyone who doesn't need to do the AIP, or for everyone who's done the AIP and doesn't know where to go next, there needed to be another step, an anti-inflammatory way of living that for some people might feel like a reset. That might feel like their extreme protocol that they go on to like reset their life and learn the lessons and carry on with all of those. But for people with the AIP, it's a nice segue to go on to of like learning about inflammation and all the other stuff outside of food. And I was researching it, I was documenting it on socials, and I basically said that I was kind of behind the scenes writing my own book and like documenting it and telling people all these pillars and how I live them in my life and how I still struggle with one of them, stress. I do believe it's a big driver of my acne and it's something I'm still struggling with. But my issue is I get so excited about work that I end up signing to like a million different projects and starting a podcast amongst writing a book, which probably wasn't a good idea, but I'm really excited to be here. But it also means that I'm up at night being like, shit, I need to prep. And it can be really stressful and exciting at the same time. And so I'm aware of all of these pillars. I was researching them. And again, researching them for myself as well, because for me, the only way, it's so annoying, the only way that I can actually take something seriously is if I learn about it, test it on myself, research it properly, speak to experts, and then see if it actually works. And that is what I did with the Anti-Inflammatory Reset, which is the book that I have written. It's in final round of edits, which is so exciting, and it comes out on the 1st of January. And by some sort of miracle, I feel like I should do an episode on like manifesting and lucky girl syndrome, because I feel like I embody it. I mean, first half of my life with the whole endometriosis stuff probably wasn't that lucky, but since then I've actually, like, whatever's up there has been looking out for me. And I was looking at my emails and had publishers come in being like, we would love to work with you on this book. And Penguin popped up and I was like, this has been on my manifestation board forever. Because the issue I had with writing this anti-inflammatory book is I was like, I want to do it properly. I want it to be a physical book in stores that people can pick up, because not everyone watches my Instagram or TikToks or whatever. And Penguin were like, we're going to do it with you. We're going to bring it to life. And I'm so excited because I genuinely feel like everything I've learned, both personally, spiritually, and in my hormone health course, with all of the science, all of the backed research, is in that book. And I really think that the reset, the anti-inflammatory reset, and there's a 30-day reset at the back of it, and there's different versions so that everyone can do it. I really think that the anti-inflammatory reset, which has a 30-day reset at the back, which by the end of it, you realize that actually you're now living a new life, living these anti-inflammatory lessons. I think everyone should do that. I think it's something that will help absolutely everyone, man, woman, dog. I think it's amazing. But the AIP is something very different. It's very targeted. It's very food specific. And again, it's called the autoimmune protocol for a reason. It's for people with autoimmune conditions or conditions similar. And it really is something you should speak to your doctor about before doing. So long story short, if someone is thinking about going through the AIP or the anti-inflammatory reset, I think it's a conversation to have with yourself and even your doctor of which is right for me to start with. If you think the AIP is the right method to go down, realize that it's a very all-in thing to do. It's going to take over a lot of your life, but it might be the best thing you've ever done. For me, it was. And then you have the anti-inflammatory reset to learn the lessons and take you on for the rest of your life. But for a lot of people listening to this, you might not need something as extreme as the AIP. It might be an overall way of anti-inflammatory living and that reset that a lot of people do, in which case the book will be the perfect thing for you. You can pre-order the book now. God, shameless plug. I hate it when people do this in podcasts, but genuinely, I think it'd be useful for everyone. So I'll pop the link in the show notes. I'm so proud of them both, the guide and the book. And I think that they're going to help so many people. Seeing people's transformations is insane. And I cannot wait to see what happens with the anti-inflammatory reset. Something else that I'm really passionate about is not only sharing this information through the guides, through the books, but also on socials to create an actual community where we have events and products that really help people. And that's exactly what we're doing over on Found. So if you want something right now to do, follow found.women's health on Instagram and TikTok. Every day we post things that are helpful on stories and on the grid. And something else that I think is really helpful is that we have Found Fridays, which is every Friday I put a Q&A on our stories so that you can ask me any question you have and I try and get through as many of them as I can. I think that is enough information and emotions for the both of us for this episode, so I'm going to wrap it up here. But I promise you that I will do everything I can to improve the way that we look at women's health, and keeping this podcast going is part of that. So firstly, I hope you genuinely found this useful. Secondly, if you know someone struggling with anything I've spoken about, please share this with them, because you can genuinely make someone's day when they feel seen and heard and actually have some tips that might really help them. And finally, if you could do me a favor and subscribe on whatever platform you're watching on right now, it means that we can do another season, which is even bigger and even better than this one. Thank you so much for watching and letting me share my journey with you, and I'll see you in the next episode.